Hello, my name is Liz Cash. I'm a clinical psychologist and I work primarily with patients who are experiencing a new diagnosis of head and neck cancer. My clinical role has been to offer patients supportive psychological services to help them liaison with needed services at our cancer center and get the support that they might need. In my research, I investigate the effects of psychosocial factors such as anxiety and depression, other things like sleep disruption and stress response systems on head and neck cancer outcomes. And that includes markers of tumor progression, patients' response to their cancer treatment, as well as overall prognosis. So I'm pleased to be presenting today with Mr. David Neu. Mr. Neu is the co-founder of the Neu Center for Supportive Medicine and Cancer Survivorship, and is also a member of the Sidney Kimmel Cancer Center Advisory Council. He has several philanthropic accolades that perhaps he might wish to tell us about. And Mr. Neu is also a head and neck cancer survivor. So good morning, David. I wonder if you would like to share a little bit with us about your personal story.
Oh, I'd love to. Liz, thank you. Thank you for the introduction and welcome everybody that's participating with us today. We've got a lot to share, and it's really my great pleasure to share some of and I really talk about our story because this is one my wife and I went down the journey together in so many ways. Kind of the top line is I was in healthcare, kind of on the outside looking in. That definitely flips the other way when you become a patient, but I was on the outside of healthcare as a provider for 35 years. And in 2016, I got diagnosed with head and neck cancer. I got very, very lucky catching it somewhat early, even though I was at stage 3B. I caught it at a time right before it started to make its way outside of the lymph node. So it was quite an interesting time. I was 240 pounds, diabetic type 2. My cholesterol was about 300 and my blood pressure was probably 145 over 95, taking medication, and I thought I was as healthy as could be. Not really the case. I got diagnosed at Jefferson, and it was really kind of an interesting set of events because head and neck cancer is very tough to catch at the beginning. In many cases, it hides behind the tonsil and then makes its way somewhere else. So I got started at Jefferson, and as we talk today, I'll share some of that journey.
Great, thank you. So I wonder if we might start with what your impressions are of perhaps what a typical patient goes through when they're experiencing a diagnosis and undergoing treatment.
You know, thanks for asking that, Liz. I get asked that particular question by so many people, especially some of the patients that I try to coach as they first get diagnosed. You know, there's a tremendous amount of anxiety and fear with any cancer. Head and neck is an unusually tough one for the patients because of how many things are involved around the head and neck area. It's a complex cancer in a sense because it can affect a lot of things that we value personally, like salivary glands and the ability to speak and swallowing and so on. So there's a lot that's going on, especially at the beginning. The thing that I would say about, you know, just the first kind of piece of the puzzle when I got diagnosed, I didn't know anything about HPV. I went in with what I thought was something small in the back of my neck, and I found out two important pieces of the puzzle. One is 80 to 90% of the people in the waiting room now are typically HPV cancer. which was brand new to me. It used to be a lot of smokers and people that had issues with drinking and so on. In some cases, it wasn't, but in many cases, that was some of the genesis of their cancer. But 80% of the waiting room was men in their 50s and 60s that had HPV cancer, a squamous cell that had a HPV characteristic to it. So I found out that HPV 16 was the most curable of the cancers. And when they did the biopsy, the bad news was that it had moved from my tonsil down to my lymph node. And I had always been raised that when you hear lymph node, that's not a good diagnosis. And I really wondered personally if my ticket was getting punched here. I really had some deep, deep concerns. But I found out through that diagnosis it was HPV 16. And the doctor said, I got you. We got this. He said, this is going to be a long road. It's going to be a very, very tough road and a bit of a painful one, but we're going to get this. And our success rate is probably 70 or 80%. So that was the beginning for my wife and I, knowing very little about the disease and about the cancer and wondering what was going to come next.
Yeah, it sounds like a very challenging experience, which it does sound, quite similar to what I'm sure a lot of patients sort of experience at that time. Can you talk a little bit about what some of the challenges were that you faced, including, negative thoughts that came up, how your social situations changed a little bit? What were some of the things that you experienced that changed because of this diagnosis and as a result of dealing with all of this all at once?
Well, what's typical with a cancer patient, especially in head and neck, there's a couple facts that are very revealing about, just kind of in general, it doesn't apply to everybody, but these are pretty accurate. About 80% of head and neck cancer patients end up with depression or anxiety or both. 1 in 5 Americans at some time in their life will have depression, and the typical age, again, these are just generalizations, it hits at all ages, but the highest period for depression to hit a human being is between 45 and 65. And for those of us that grew up at a period where we may have, through contact, ended up with HPV, it generally takes 10, 20, 30 years for the cells in the throat to change and evolve. And so, you talk about people being in their 50s and 60s, typically with HPV throat cancer, that's a big reason why. So, when I found out about this, and I didn't really know any of those stats. And I didn't know the significance of what it meant for the depression part of the disease. And as I think everybody who's gone through any tough time or cancer in particular knows, it's very hard to heal if you've got depression. The mind-body connection is really everything. And, the biggest challenge that I think we faced, my wife and I, my wife's name is Esperanza, Espy. Espy and I talked about, what it was going to take emotionally to get through this. And I happened to be at an institution that had a good background, not only in terms of social workers at Jefferson, but the psychologists and the psychiatrists. But there's virtually no reimbursement for it. And so the process and the care pathway for a patient to be assessed, whether or not they might be an opioid abuser, have they had depression before, what's the likelihood they might end up with depression, that was a fringe conversation. And I really had no idea that the typical patient ends up with almost a PTSD type of effect and it's usually 4 to 6 weeks after the treatment. And it's very, very significant. And so when I first got diagnosed and I was going through my treatments, I was just fighting the good fight, and I really didn't have visibility to what was coming, which I know we're going to talk about today. But one of the most important parts of the care plan is in the psychosocial arena, and I really at that time had no visibility to it.
Well, you bring up a really interesting point, and one of the tenets that I kind of feel strongly about is that the vast majority of some of these emotional and psychological symptoms may not come up until the end of treatment. It might take a few weeks to kind of really have everything sink in, get through the treatment process, and kind of face what's coming, further down the line in the future. And the earlier that we can intervene, the better off our patients can fare, in the long run. We can find strategies that can help them be effective at coping with some of those challenges when they come up in the future. And if we intervene early, then they already have these strategies in place and can start to cope immediately without the delay of looking for a provider and trying to find the specific sorts of care that they need. So would you care to talk about some of the strategies that you used when you were facing some of these challenging emotions and thoughts related to completion of treatment and forward-looking aspects?
Yeah, I'd love to. It's been so much a part of our life. I started, I think in the early stages, doing what every family I suspect does, having conversations with their parents, their children, their loved ones. Some people feel that they really want to keep this to themselves. Everyone has a different way of dealing with it. I had felt that I wanted to share my experience with everyone around me. I needed that care. I needed that love and the things that come with it. And I was very, I had a big dilemma about whether or not I was willing to share with the world around me that my cancer was HPV because of the stigma around it. And then I started to find out that, probably, I don't know the exact numbers, but probably 85% of the country's been exposed to HPV. It's not just a typical disease that's passed sexually, that this is actually passed through other ways, even, kissing when you're younger, deep throat kissing, and there's some other ways it can get passed. But some people end up with HPV, it gets knocked out right away and they never show symptoms. Some get it later on in life. It has a lot of different iterations, but the cancer, the potential for cancer is very high with HPV and with certain individuals, and in certain types of cancer. Women get affected a bit differently than men. So at the beginning, I was, I was really spending a lot of time with family. And the one piece of this that I would bring up is that it stirs up a lot in the family. People have their own experience with cancer. There's fear about what it means to you. Your own mortality is at stake, especially in the early stages. You're not sure where things are headed. And so the beginning of this was trying to work through it with the family. And then as you're in bed with a feeding tube and your mind is going 100 miles an hour, you start thinking about a lot of the pieces that we all do, but it's kind of a 24-hour-a-day thing. And so I started down a path of understanding this disease and the things that were working and not working for me from a perspective of how care is delivered to such a complex disease. And the one area that I share with a lot of people is, if you think about it, you have 5 or 6 care teams. You have the group that provided radiation. You've got the group that's giving you chemo. You have the group that provided, in my case, surgery. I had robotic surgery in the mouth and through the neck. And we're in a wonderful age where technology allows them to go in robotically and do that. They used to have to cut you down and kind of pull your face and separate it and then do restoration surgery. So I was very, very blessed. And then you have a nutritionist. And then you have someone that's working with you on lymphedema, and you have someone that may be working with you on the psychosocial piece. And so we had a social worker. And so the connections between 4 or 5 groups was something I realized as going through it needed work. It needed connection, it needed communication, it needed higher visibility. I was doing a tremendous amount of work on the internet, which is the wild, wild west, as we all refer to it, trying to understand as much as I could about dealing with my pain, dealing with a tremendous amount of side effects. And there was, in some cases, differing points of view depending on which care team you would talk to. And that really was the impetus for my wife and I to talk with Jefferson about helping fund the Neu Center for Supportive Medicine in Cancer Survivorship, and to think really about the psychosocial piece, about how to get resources involved earlier, and how to have quarterbacks that could coordinate all these different care teams with the patient. And that's really how things started and kept my mind busy, which I desperately needed when I was going through this.
So thank you for sharing all of that. It sounds like you found some great opportunities to take a really challenging situation and turn it into a really positive outcome, not just you, but for many other people. And you've touched on a really important point, that there are several different individuals involved in care of cancers like these when they're complex like this. And we all come from different backgrounds. We have different points of view and perspectives on what might work best, or what seems to be, top of the evidence base at the time. And we do have to communicate. We do have to all, be on the same page, but at the same time, we also have to recognize that different strategies work for different folks. And some patients need more, some patients need less. And we get to let them tell us what they need and where they're at, and work with them wherever they are and figure out what makes the best approach for them. So it does require a lot of coordination. You're right.
Yeah, and I think I was one of those patients that I felt like, and maybe every cancer patient feels like this, I got impacted with every side effect that you could get at one point or another. Liz, I think it's worth talking about the physicians that were involved, because they had so much to do with where we ultimately ended up, my wife and I, about decisions for my care. Dr. Joe Curry, arguably one of the best surgeons as it relates to robotic surgery for head and neck. And he did both my 3-centimeter tumor in my throat, as well as took out, I think, 32 lymph nodes. And it was only in one, thank God. And I had just fantastic care. And this is just a side note, but after all of this, if most people look at my neck, they can't even tell that I have a scar. So maybe he should evolve to be a cosmetic surgeon or something. I'm not sure, but a plastic surgeon. But I did want to mention Dr. Bill Keene, who is the chair of the department and really shared the vision. He shared his perspective and an agreement that we really needed comprehensive care. We needed a holistic approach, which included the psychosocial piece at a higher level, and the care pathway, this whole notion about having a quarterback. He helped build the department from the ground up, and he knows the challenges associated with a large health system that's got so much on its plate, dealing with making sure that all these different care groups are talking and communicating on a regular basis. So that, as I mentioned before, was how we ended up opening the new center. And that's really what the genesis and mission now is. Every patient that comes in sits down for 90 minutes. They meet with all the different methodologies of care. They meet with a social worker. They end up with a nurse navigator as their quarterback. And then some go down the integrative healthcare approach like I did, and some just stay with the more traditional. For me, for my mental health and for my physical health, it was essential that things like therapeutic massage, acupuncture, I use vitamin C, high doses of IV vitamin C to detoxify the cisplatin out of my system. I used a hyperbaric chamber for 90 minutes a day for, I think it was 5 weeks, to help with the healing, especially in my throat. I think it helped me get, ironically, some of my salivary glands back at a higher level. I probably have 70% of my salivary glands. That's a very high number for a head and neck patient. If that had anything to do with the hyperbaric treatments, who knows? But I think you have to do those things that you're comfortable with. And then I had a psychiatrist that dealt with my PTSD. I got hit like they all do. I got hit with depression about 6 months after the treatment. And they did a brilliant job of helping and guiding me through. And not all patients get that. In fact, many don't. And it is, for me, I don't know how you heal unless you've got that piece. You've got that piece of the puzzle addressed, and you're working through that as you're working through the physical components of cancer at the same time.
Yeah, that's a very excellent point. You bring up a lot of great points in the things that you've already mentioned, kind of having done so far. I want to go back to the notion of, you mentioned earlier, having some, racing thoughts kind of preventing you from getting some sleep at night, and working with a psychiatrist, psychologist, social worker, all these fabulous folks who have different aspects with which they might be able to help someone manage some of those things. Would you care to discuss any strategies that you were taught or things that you tried that did or didn't work to help kind of address that symptom in particular, some of the challenges that we face with our thoughts?
I had a brilliant massage therapist. Her name's Hillary Sohn, and she's in Philadelphia, and she worked on scar tissue that was up in my neck area. It was extremely effective for me on quieting the mind and allowing the body to heal. I had a gentleman who was a physician at Penn and then went to Beijing and got trained in the art of acupuncture. So I had kind of this mixture of East-West that really was a significant deal. And then I started swimming. As soon as the feeding tube came out, which was the biggest day in my life, because dives, drive-ins, and diners was my favorite show because I couldn't eat. And so my wife couldn't figure out why I would torture myself watching that. But I couldn't wait to get a cheeseburger back in my mouth. So anyways, when the feeding tube came out and I could have my first, bowl of broth, I started swimming. Once I had enough healing and around where the wound was, I started swimming. And swimming for me was a game changer. Emotionally and physically, it really was something that I can't even put into words. And everyone needs to find, what's right for them. My suggestion, and I share this with patients when I talk to them, is they have to do something. The lymph in your system that's carrying the toxins does not move on its own. It moves when you move. It's not like the heart that has its own pump. And so you have to move. And your lymph glands get impacted. And because I had the 32 lymph nodes taken out, it was really important that every day I made that part of my regimen. And I think if people have a focus on the 4 or 5 things that they believe are essential to their healing, and psychosocial care is one of them. And they really stay focused on the things that feel comfortable for them, reduce their anxiety. They've got the highest likelihood of healing of not just for head and neck cancer, but for really, in my opinion, for any cancer.
That's great, David. You bring up a lot of really important points again. And one thing I want to echo, some of the sort of themes that I've noticed kind of running through the experiences that you've had is that it really sounds like, and this can happen for a lot of folks, that there was a significant shift in your personal priorities once you experience this diagnosis and treatment and the challenges that come along with all of that. And for some folks, that shift might be related to, taking better care of themselves by eating differently or exercising. For some folks, it's reconnecting with family. And these are, what we think of as personal values. And I think it's really important that folks have a chance to, identify what their values are. And I think of values as sort of a compass, something about that's a little more abstract and something about the way you would want someone else to describe you, like as a person who's trustworthy or who's caring, versus a goal, for example, which is sort of a tangible objective to obtain. And when our values are in line with our goals, then we seem to be able to do our best. And it sounds like you were really astute at being able to identify what your values were and then find the goals that really fit in with those values. And then once you had that, you had this pathway, right? And you were able to engage in these committed actions that helped you stay in line with your values and also obtain your goals. So things like, swimming, you realized you wanted to make sure you were doing everything that you could to heal, and you knew that movement was so essential to being able to flush the lymph nodes out and support the immune system. And so your goal was to get physically fit, and swimming was the perfect avenue for you, it sounds like. And so it really shows how powerful it can be when you start to commit to these actions, and however small they might be. But when actions, goals, and values all sort of align, then we can live a meaningful life and feel that we can find ways to be fulfilled despite whatever obstacles might arise. So kudos to you. It sounds like that really just sort of came naturally for you, it sounds like.
Well, thank you. I'll share something with you that was kind of a framework for me. And I also wanted to just thank a few people that were just extraordinary in the path. I mean, Dr. Bazan, who was at the Integrative Health Center, was just invaluable in my healing. The things that I learned I do to this day, my shakes that I make every day, I've learned how to make them taste a little bit better, but it's all part of the overall plan. Karen Knutson, who's head of the medical center, is just brilliant, and to be involved as part of the advisory council has been a real gift to give back. And Dave Cognetti, who got me involved in a number of organizations and really helped me understand ways that I could make some deeper contributions. And Elizabeth Dale, who runs the Office of Institutional Advancement, and Steve Klasko, the CEO of Jefferson, they really took me into the family. And the reason I bring, in addition to wanting to make sure I recognize those people, is the reason I bring this up is that I saw this TED Talk, and the TED Talk was maybe you've seen it, the areas of the world where they have the highest percentage of people that live over 100 years old. And there were 5 characteristics that were common to all of them. Number one was to most of these people worked every day of their life till the day they died. Now, it may have changed as they got a little older, but they worked every day of their life. And that's why I'm back working now. Someone had told me that I'd be back full-time at 63 working. After I retired, priorities change. Second, they revere their elders. It's a very important part of those cultures. The third is they don't do exercise like they're going out to a gym every day, but every culture in Okinawa, they're runners, and in Greece, they had their own activities at the water, and in Italy, it was goat farmers, and they were up and down the hills taking care of the animals. The The fourth is to have a very passionate thing that you're getting up every day for, that is part of your life. And the fifth was diet was in there. The Mediterranean diet is probably a good example, but each one of these cultures had some different attributes to their diet. But at the end of the day, those 5 pillars for me, I try to really think about those and live those, whether they're spiritually, they're physically, psychosocial piece, the nutrition piece. You really have to have a plan that you're committed to and understand more than anything. Take the risk to put yourself out in the world. Let people know your challenge, because I don't know many people that are in a family that hasn't been touched by cancer at some level. And let people love you and talk to you about what they've experienced. Open up your heart to it. And the body understands that. The body heals from those things. I believe it just in every part of who I am. And I'm here for round 2 in life for a reason. The big guy upstairs gave me a second opportunity for, I don't know what they call it. It's not retirement, it's rewirement, I think is the word. I'm just so happy that I could share some of this with you today. And any questions that you've got, Liz, or the group that's involved, they can contact me at any time.
That's great. Very powerful message. Thank you so much, David, for sharing your experiences with us today. I was so pleased to be able to chat with you about this.
Great. Thank you.